It's always the sperm, it's always the egg, it's always the embryo, it's always the uterus. Now, those are very generalizations because there's the hypothalamus, the pituitary, the adrenals, the thyroid. I mean, there are many organ systems that are required for normal reproduction. And so I think it just, if you just, it's inflammation, which damages either the male side, the female side, or both. And usually when someone says, well, we only have a male problem, I'm like, well, but I can't ignore your side because you guys are in similar environments and the likelihood that you're both exposed to these things that we've talked about is high. So we have to be cognizant it's both sides. And so I always talk about nutrition and inflammation and ways to reduce inflammation in your body. But infertility is growing rapidly on all sides. Younger and younger women are experiencing it. I think we're also experiencing it in utero. Moms are consuming a plant-based low animal fat diet with many of the antigens, chemicals, and sugars which cross the placental membrane and damage the reproductive organs of that fetus, male or female. And so it may be a lifelong damage that's happening. It may deplete the sperm cell production or the egg cell production, causes more rapid degeneration and death of those cells, or it may cause tubal or uterine anomalies that are a baby is born with no connection to the vas deferens, or there's no sperm production, or the uterus tubes and are malformed, which can also lead to fertility issues. But to me, the most common is simple. It's inflammation, which damages the tubes, uterus, ovaries, testicles, and the sperm in ways that aren't always visible. They're not testable, but I see so many people with unknown cause or idiopathic infertility. And for me, I always ask the question, what are you eating? And it always comes to healthy, organic, clean, and it's mostly plant-based, lean meat, very little to no red meat, and no animal fat.
So talking of tests, what tests do you run routinely to identify specific problems?
Well, the simple part for the male is look at a sperm count and look under the microscope and look at the morphology, the motility, the count, the progression of the sperm, and those are really pretty gross evaluations of the sperm, the volume, and if these are abnormal or even if they're normal, it doesn't mean conception won't happen. Or will happen. You know, it's not it's kind of an all or none. If you have no sperm in the ejaculate in a cup, then we often will do some hormone measurements. We'll do an exam for testicular scrotal size, and we'll often stick a needle in the testicle to see if there's sperm there. I mean, that's the basics for the guy, but there's always a history for both. You know, how long you've been trying? Do you have regular cycles? Do you have any other medical conditions, allergies? And I ask always, what are you eating? And that's the one thing I think we've never really been taught to ask that question, but that's critical. And for the female side, are you having regular 28-day menstrual cycles or monthly cycles? Which if you have irregular, it usually means either polycystic ovarian syndrome, some hypothalamic pituitary thyroid adrenal ovarian axis abnormalities, which I think are still all related to that plant-based low animal fat diet. But we can do an ultrasound to look at the ovaries. We could do a dye test to look at the tubes. And we could do an ultrasound to look at the uterus also in the cavity, and sort of gives us a gross evaluation. Does it look normal? Do you have fibroids, polyps? Do you have endometriomas? Do you have cysts in and around the ovaries? Kind of lead us down the line. Might it be a metabolic disorder, prediabetes, or polycystic ovarian syndrome? Might you have endometriosis? And sometimes a surgical procedure might be required along with some endometrial biopsies where you're looking for evidence of inflammation or bacteria, yeast, or viral colonization, which I think is very rampant for all of us, and women especially. And maybe to digress just briefly, but James Henry Salisbury steak fame, he was a surgeon, a physician, graduated Albany Med here in New York, USA in 1850s. He was in the Civil War and his men were dying of dysentery and pneumonia. And he figured out that the plant-based diet was allowing the microbes, the bacteria and yeast, to proliferate. Now, in women, the distance between the rectum and the vagina is very small. So there's a lot of bacteria and yeast that go into the vagina that go up into the upper reproductive system. Now, men, it's harder to get into the urethra and it's a lower risk of those things, but not a no risk. But basically, the proliferation of these microbes in the gut go out the rectum, up and through the esophagus and the upper and lower respiratory systems, and go into our reproductive systems, which cause the damage in our body. That's why one of the things I often recommend is a 2 to 4 week treatment of a antibiotic, antifungal, and an antiviral, especially if you're kind of finding everything looks normal, we're not finding any abnormalities. I believe there's a lot of colonization, and bugs are not easy to get rid of in our body. They love you because they love the sugars and the proteins you eat, which allows them to thrive and survive. And again, if you think about it, microbial infections are so common in our world, and we can't see them, unfortunately. But that plant-based diet is probably the culprit that leads to all those problems.